Hi, my name is Jeff Steinberger. I'm a physical therapist at Prairie Rehabilitation Services. Today we're going to talk about 55 ways to improve your balance, and we should be done with that in the next 2 hours. What? Not 2 hours? Oh, sorry. I guess I'm talking about 5 ways to improve your balance, and Morgan says I have to talk only up to 15 minutes. I brought the bike in today with the safety stuff to talk about you being safe and you being aware of being safe. Because I only get to talk 15 minutes, I get to throw this away. Prairie Rehab is blessed with a lot of very talented co-workers. We do have their talks are on the YouTube channel, which is, if you go to YouTube and type Prairie Rehab, then physical therapy in the search bar, that'll get you to our YouTube channel. Many of the things I've talked about, we have talked about, and some of my other colleagues have talked about. Jason has talked about lower extremity strengthening. We have talked about things that you can do as farmers and as workers to protect yourselves. And we have talked about different things that you can do to work on getting stronger for your back and protecting your back, etc. Today we're going to talk, like I said, about balance. One of the things that you need to be aware of, and the reason that I brought this in to show you some safety ideas, is that during the course of the year, approximately 30% of people that are over 65 years old and up to 50% of people that are over 85 years old fall. Out of those falls, about 6% wind up with fractures, and another 5 to 6% wind up with aggressive and severe soft tissue injuries, such as severe bruising of muscles, torn shoulder muscles, hip injuries into your legs and other parts of your legs, and chest wall and so forth. So we want you to be safe, and to be safe for some of us means that you use a cane, means you use a walker, and it means that you do not go on your own from place to place, cruising on furniture and so forth, because that piece of furniture that you lean on can slide away, or your hand can slip and you can fall, or you can wind up. I've had patients who've used the wall to keep them upright as they bounce off the wall, because all of a sudden their knee gives them some problems and the wall catches them. What we want to do is we want to make sure that preventing those kinds of near misses is extremely important. As you have problems with those kinds of things, people also develop a fear of falling, and then as you're afraid of being on your feet, you tend to withdraw more. And during these times, we have lots of people that are already withdrawn and have been to do shelter in place and so forth, and we are built to move. So we want you to be active, and we want you to be safe while you're active. At home, the other things that you can do are to remove rugs. You can be careful as you're going to the restroom or to the bathroom, and be careful when you go to the kitchen. A lot of people fall rushing to the bathroom for a variety of reasons, but honestly, a lot of it is that there is a very strong urge to use the bathroom, and to stay clean. You don't want to not make it, and so in the rush you wind up falling or tripping or catching a foot or heel on a ledge or a door jamb, and then you're in worse trouble. We do have at Prairie Rehab specialists in lots of different areas. You've already met some of them. We've talked about people that have expertise in taking care of your back, taking care of your arthritis pain. Our occupational therapists talked about ergonomics. And again, as individuals, I certainly do not know, but everything, and none of us know everything, but as a group, we have a very talented group of individuals, and again, can rely on each other to use that expertise to learn from each other as therapists to be able to help you out to the best of our abilities. Again, just want to remind you, if you have been instructed to use a cane or a walker, please do use so. Now my daughter provided me with some bad dad jokes as a transition on this, but in the interest of saving you all, I'm not going to be using those today. However, if you would like some, do let me know and comment on the comment section. If you have other questions, please comment as well on that. And Morgan will find people that know the answers and will be able to do that and respond to you and help you out. One of the other problems that we find with a lot of people that fall is that as you tend to have more medications, your risk of falling goes a lot higher. What the research shows is that if you have typically more than 5 prescription medications, your chances of falling during a given year go up significantly. I cannot do anything about the medications, so we're going to retitle this 4.5 ways that you can do things to keep from falling instead of 5. My halfway is to remind you, talk to your medical provider, your physician, your physician's assistant, your nurse practitioner, or pharmacist, and have them go through the medication list with you so that you are only using the medications you absolutely need. Take them the way they're prescribed and follow directions on when you're supposed to be taking them and how you're supposed to be taking them. Another concern and another fall risk factor are people that have vision problems, and there's lots of different visual acuity problems. There's people that sometimes have a blocked vision on one side or the other, and as I'm getting older, I don't see as acutely, and you may have that same problem. So one of the things to be aware of is to go in and see your vision professional, whether that's your optometrist or ophthalmologist, on a routine basis to make sure that your vision, and you're not losing your vision because you only have one set of eyes. And there are a lot of things that they can do that will help you to preserve and keep your eyesight as sharp as possible. The other thing that we see with vision problems are, as we get older, are moving from light to dark and dark to light slows down. And so when you happen to be the age of a lot of our therapists are, which are younger, they transition very quickly. As we get a little bit older, that is much slower. So another fall risk is to make sure, if you have to get up in the middle of the night, or if you're watching TV and have to get up and go do something, to make sure that there's a light on so that you can see where you're walking to, and that way you reduce the risk of stubbing your toe or running into a piece of furniture or simply slipping and falling. And along with that, we did talk about earlier about picking up throw rugs. I have a friend of mine who has a good example of fall risk. His name is Steve, and he said it would be okay to talk about him on this. Steve happens to be a person who has an amputated, actually double amputee, and walks really well. When we work with Steve, we work with him on some strengthening and work on some balance activities, and he's gotten very good at them. About 2 months ago, Steve started a new job at a different place, and as he was working, what happened is all of a sudden he slipped and fell, and very unusual for him. And he thought that maybe something had gone wrong with his leg, and he wasn't able to feel in his hips and legs what was going on. About 10 days later, the same thing happened again, and so he became a little suspicious because it was very unusual. So he talked with the place where he was working, and what he found out is on the floor coverings, there was a drain hole in where the floor was, and instead of filling that in to making it level, they just followed the contour of the floor. And as he stepped onto that, because he didn't have the sensation through his feet and lower legs, that threw him off to the side, causing him to fall. So I think that's a great example. Again, be aware of your surroundings. Be aware when you go into new surroundings to look and make sure that the coast is clear. And then be careful as you're exploring and looking at new surroundings. Now, as a physical therapist, I'd be remiss if I didn't say that there's probably some exercises you could do as well, because we do a lot of exercises with our patients. And this afternoon, I have a lovely young model who is also known as Micah, who has volunteered to help me out. Micah is one of the people I've had the blessing to be able to work with at different times. His great ideas, and part of our team at Prairie Rehab, and part of our strength we really feel is working together as a team, as we talked about, not only between OT and physical therapy and speech therapy, but within the team, in this case Micah and I being part of the physical therapy team working together. And one of the real advantages that I have is working with that kind of talented people, that what I see in my approach is improved upon by getting ideas from people like Micah that can really help me out. So he has agreed to help me out today, and I appreciate that, so thank you. We're going to talk about only 4 exercises today, since Morgan said I couldn't do my 55, and I did half of one. We remember was the medication. One of them was to make sure that you're safe. But we're going to talk about 4 exercises. And Micah, being the talented young man, we're going to have him lie down here first. And
no pillow?
No pillow, no. If Micah was stiff and old like me, we might have a pillow under there to support. He's going to bend his knees up in the air, and we're going to work on a little bit of hip strengthening. And as you might have guessed, we're going to do some bridges. And there's a couple of ways of doing this. So we're going to have you just lift your hips up in the air and back down. And so when I do these with my patients, I usually do these in groups of 150, but for brevity today, we're going to do 15. One of the things, I'm going to stop you for a second. One of the things that we want is we want you to keep your hips in a line with your knees and your feet. And then the other thing that there's 2 ways of doing these. One is that you come real tall, come up high, which is going to work the back extensor muscles. We should have had you tuck in. The other one, you're fine. I'm going to embarrass you, sorry. And then the other way of doing it is just go all the way back down, and then just do with a pelvic tilt. So is to a little higher, is to roll up and then back down that way. And that's going to work the muscles a little differently, but in general, that's going to work your hip muscles and the glute muscles, which is a great way of getting you a little bit stronger. Thank you. I'm going to have you stand up next. And we're going to pan over to the bar here. At home, this happens to be the kitchen sink a lot of times, or a counter. We need to use it if we need to for balance. And can we pan down to his lower legs? Okay, so what Mike is going to do is lightly rest his hands on there, and then he's going to do heel to toe raises. So he's going to come up on his heels and go back down and then onto his toes. And as he's going up and down, we want to make sure that you're picking up those toes so that you're strengthening the muscles on the front of your lower legs, because those are very important balance muscles. And as he's coming up tall, he's coming straight up and down and maintaining a good sense of balance. I like this exercise because it works a lot of things, and as it gets easier, Micah could do that certainly without holding on. And as you get stronger, you might hold on with one hand or no hands like he is doing. Again, we like to do these in 15s and 20s. Sometimes people will do more, but that seems to do the job. A lot of times we'll do once or twice during the morning and once or twice in the afternoon, so get them in a couple times a day. And especially if you have the time to do it now, I would encourage you to do it twice a day. The third exercise that we're going to have Mike could do is what we call mini squats. And so if you can imagine that there would be a chair right here for Mike. In fact, I might grab a chair for you. I might have you grab a chair since you're stronger and young. There we go. So there's a couple of ways to do these, but as you do these, what we want you to do is think about moving towards sitting down. And then come back up. So we don't have to go into that deep of a squat. You could do halfway, a quarter way down. There we go. And again, he's using his hands to balance. He doesn't need to use his hands to balance if he wants to work harder, which really doesn't bother me to work him hard. He's used to working hard. And then if that gets too easy, go all the way down to the chair and then come back up. And you'll notice that as he comes back up and goes down, that he's leaning forward. So this also works on weight shifting or the natural way that we move from sit to stand, which again is important that we are safe that way and use that natural tendency to our strengths. Thank you. Now I'm going to have you turn and face Morgan. Now another way that we can do the same thing, you know your face, you hold on there for balance. So sometimes as you get a little bit stronger, we're going to go toe touch to 12 o'clock, and to 6 o'clock, and to 3 o'clock, and to 9 o'clock, and then do that again. So you do toe touches in different directions, again using the vision of a clock, and you can go any direction you want and then switch legs. So again, this is going to be a little bit harder. This also works a little more on balance. And this works very nicely on single leg balance because as we walk, hopefully you're going to be lifting that one foot up and moving it forward. And as we walk, one of the things we want you to be aware of is touching heel to toe. So accentuating a little bit, if you could show that. Not tandem, just heel to toe. Just heel to toe. Just normal walking, touching your heel down first, because as you do that, again, that ties into what our normal balance strategies are. It asks us to use our feet and ankles versus our hips. Lastly, what I would like you to do when you're working on balance, we want to work on some other strengthening, and for that, I would like you to take your two friends walking with you when you go walking. And our two friends are called Suck and Tuck. So Mike is going to turn sideways to you. And what we want to do is we're working on some core strengthening. So we're going to pull in here and then tuck your hips underneath you. So we don't want you to go ahead and stand like I ordinarily do, kind of all slumped over. We don't want you, go ahead and slump over. We don't want you doing this because that's going to shift your balance forward and then hyperextend. And this is going to shift your balance backwards. So we want you to find neutral. So again, pulling in your core, belly button to spine. Again, Michelle talked about this with the low back. This is another way of doing it. We talked about this for leg strengthening, and we've talked about this for shoulders and arms. And then keeping your pelvis tucked so you're in alignment with your ear. Look straight ahead, sir. Your ear, through your shoulder, through your hip, behind your kneecap, and in front of your ankle. And having that good strong posture when you're upright and moving around, just relax into a poor posture. So here, when things go, you don't have the stability, better posture. And here, he's nice and solid. So as you're walking, thank you. As you're walking, again, we want that good core strength, that good core stability, which we talk about as lessening pain, as we talk about strengthening your legs as you're moving, in other talks that we've talked about. And we're going to talk about that next week when Megan and I talk to you more about exercises. Any comments on any of those things that we just did?
Oh, all good information and very beneficial.
And very efficient.
Yes.
All right.
And not too hard.
But you can make them more difficult if you need to. If they're too easy, we have ways that we can make you work harder.
Worst thing to say to a therapist.
The worst thing to say to a therapist is way too easy. So thank you.
Yes.
All right. So again, just in summary of what we've talked about, We want you to be safe. Use the safety equipment that you've been provided with. Make sure that you're using your walker. Don't cruise on furniture. Pick up, throw rugs. Be aware that vision changes and visual changes going from light to dark slow down. So use a light at night. 2 major fall areas and risks are going to the bathroom and in the kitchen, so be careful in those areas. Be careful with the medications that you're on. Make sure you're following the directions you've been given to use the medications and use them appropriately. If you have multiple medications, just double check with your medical provider at some point to make sure that you still need all of those, because sometimes we are guilty of thinking that we still need them and they thought that they changed you from that. Or you can talk with your pharmacist as well. Finally, we want you to be strong and we want you to be in balance. To be not moving is not healthy. We're built to move, so we want you to not be kind of closing in on yourself. We have lots of different ways of helping you to do exercises and working on your safety. Again, if you have any additional questions, feel free to contact us on Facebook. You can send us emails on any of our websites. All of our offices have websites and emails attached to them. You can email us on our blog as well. And we do have a YouTube channel. Again, that is, go to YouTube and do the search function, go into Prairie Rehabilitation, and then physical therapy, and that should bring you to our YouTube channel. All of the things that we've talked about over the last several weeks are on there. In addition, we have some other education videos on there, and we'll be putting more education videos on in the future. Thank you for watching, and I hope that you have a really blessed day.